Hello everyone, welcome to my channel Dr.shil's Physiotherapy. Today I will discuss about some cardiopulmonary MCQ questions which are frequently asked in different entrance exams of physiotherapy. This will be the uh, first part of the cardiopulmonary series. Let's start. Today's first question is, which of the following is known as Adam's apple? This question is asked in JIPMER. So the options are option A, epiglottis, option B, cricoid cartilage, option C, thyroid cartilage, and option D, vocal cord. Here the correct answer is option C, thyroid cartilage. So Adam's apple is the laryngeal prominence formed by the thyroid cartilage. It is more prominent in male due to hormonal influence during puberty. Epiglottis is leaf-shaped leaf-shaped cartilage that prevents food entry into the trachea during swallowing. Uh, carotid cartilage is ring-shaped cartilage below thyroid cartilage, and vocal cord is soft tissue structure inside larynx. So it's not a cartilage. Next question. The mucosal lining of nasal cavity is covered by option A, squamous cell, option B, ciliated cell, option C, non-ciliated cell, and option D, transitional epithelium. So the correct answer is option B, ciliated cells. So this is the image of epithelium of nasal mucus or mucosa. This is basically the ciliated structures. Next question. Question number 3. The lymphoid organ located in pharynx. Option A, adenoid. Option B, thymus. Option C, spleen. And option D, supraclavicular lymph node. Here the correct answer is option A, adenoid. Adenoid is the pharyngeal tonsil, also called the pharyngeal tonsils are basically lymphoid tissues located in the nasopharynx. And thymus is located in the mediastinum. Spleen is located in the left hypochondrium, and supraclavicular lymph node located above clavicle. So this green marked area is called the adenoid, only lymphoid tissue located in the pharynx. Next question. Where are the central respiratory control centers located? Option A, thalamus. Option B, cortex. Option C, medulla. And option D, hippocampus. This is the very easy question. The answer is option C, medulla. Central respiratory rhythm is generated by the medulla oblongata. So, this is the image, and the medulla includes ventral respiratory group and dorsal respiratory group and the ventral respiratory group. Here, the thalamus is a sensory relay station, cortex voluntary control, and hippocampus memory related structure. Next question. At birth, the shape of the chest is option A, barrel-like, option B, circular, option C, uh, elliptical, option D, triangular. Here, the correct answer is option B, circular. In newborn, ribs are horizontal, anterior-posterior diameter is nearly equal to transverse diameter. So, the chest is basically circular. Next question. Palm handle movement is a feature of option A, lower rib, option B, upper rib, option C, middle rib, and option D, none of the above. Here, the clear answer is option B, upper rib. Palm handle movement increases the anterior posterior diameter of the chest, seen mainly in the upper ribs from second to sixth rib. During inspiration, lower rib shows bucket handle movement, which increases the transverse diameter. Next question, question number 7. Which of the following is a contraindication for chest percussion to neonate? Option A, presence of chest tube. Option B, signs of acute respiratory distress. Option C, hemoptysis. And option D, bronchial spasm. Here, the correct answer is option C, hemoptysis. Hemoptysis when uh, there is coughing out of blood or blood stained mucus from the respiratory tract. This is a pure contraindication for chest percussion because the physical manipulation could exacerbate bleeding and potentially leads to choking. Next question. Uh, while treating a patient for cardiac rehab, a physical therapist relies on the Borg PI scale. The Borg rating of perceived exertion scale is most representative of which type of the data scale? Option A, nominal. Option B, ordinal. Option C, cardinal. And option D, marginal. Here, the correct answer is option B, ordinal. Borg-Peary scales basically rank from 6 to 20. Value shows order, not equal interval. So, it is a ordinal scale. If there is equal uh, measurable interval, then it will be called cardinal. Equal measurable intervals. And nominal, there should be no ranking. Example, blood group. Marginal is not a valid data scale. Next question, question number 9. Angle of Lewis corresponds to option A, T2 T3, option B, T3 T4, option C, T4 T5, and option D, T5 T6. This is very important question asked in many exams. So the answer is option C, T4 T5. So this is angle of Lewis. Or the sternal angle. Angle between the parallel of body of sternum and the manubrium. Next question, which technique helps prevent alveolar collapse in postoperative patients? Option A, postural drainage. Option B, deep breathing exercises. And option C, diaphragmatic breathing. And option D, incentive spirometry. Here, the correct answer is option D, incentive spirometry, which are frequently used in hospital setups. Postural drainage basically helps in secretion removal, not a alveolar expansion. And deep breathing exercise helpful but less effective than spirometry. And diaphragmatic breathing exercise improve breathing pattern, not the primary prevention. Next question, the position of lung is up to option A, T8, option B, T10, option C, T12, and option D, T7. Here, the correct answer is option B, T10, and the pleura extends up to T12. Okay. Next question, the maximum diaphragmatic movement is option A, 1 centimeter, option B, 2 centimeter, option C, 3 centimeter, and option D, 4 centimeter. Here, the correct answer is option C, 3 centimeter. Normal diaphragmatic excursion. Wide breathing, it is near about 1 to 2 centimeter, and in deep breathing, it is about 3 to 4 centimeter. Next question, surfactant is secreted by option A, type 1 pneumocytes, option B, type 2 pneumocytes, and option C goblet cell, option D Clara cells. Here the correct answer is option B type 2 pneumocytes. Pulmonary surface tension reduces surface tension and which ultimately prevents the alveolar collapse, which is secreted by the type 2 pneumocytes or the type 2 alveolar cells. Type 1 pneumocytes helps in gas exchange only. Goblet cells secrete mucus in the airway, and Clara cells basically helps in detoxification and airway protection. So this is basically a type 2 pneumocytes. Next question, normal arterial blood pH is option A 7, option B 7.2, option C 7.35 to 7.45 and option D 7.6. Here the clear answer is option C 7.35 to 7.45. The normal resting cardiac output in an adult is approximately option A 3 liter per minute, option B 5 liter per minute, option C 8 liter per minute and option D 10 liter per minute. So the cardiac output is heart rate into stroke volume. So heart rate is near about 72 per minute and stroke volume is 70 ml per beat. So it is near about 5 liter. So the answer is option B. Next question, V by Q for normal gas is, so the ventilation perfusion ratio. Option A 0.8, option B 1, option C 1.2 and option D 1.1. So the ventilation perfusion ratio for normal blood gas is option A 0.8. Next question, central chemoreceptors are stimulated by option A increased partial pressure of carbon dioxide, option B hypoxia, option C decreased partial pressure of the carbon dioxide and option D SaO2. Here the correct answer is option A, when there is increase in partial pressure of the carbon dioxide. Central chemoreceptors are present in the medulla, responded when there is increased partial pressure of the carbon dioxide. Next question, question number 18. Approximately the parietal pleura extends dash ribs below the lung. Option A 1, option B 2, option C 3 and option D none of the above. Here the correct answer is option B 2. Next question, question number 19. The most important buffer in blood is option A phosphate, option B protein, option C bicarbonate and option D hemoglobin. Here the correct answer is option C bicarbonate. Bicarbonate carbonic acid system is the primary blood buffer closely regulated by lungs and kidneys. Next question, question number 20. Pink, frothy and profuse sputum is seen in option A, option A, pneumoconiosis, option B, uh, lobar pneumonia, option C, acute pulmonary edema, and option D, aspergilloma. Here the correct answer is option C, acute pulmonary edema. Pulmonary edema causes fluid leakage into the alveoli mixed with air. Uh, so this is the condition of pulmonary edema. This is edematic fluid. So pulmonary edema is caused by fluid leakage from small blood vessels in the lung into the alveoli and the surrounding areas. As a result, the alveoli cannot exchange oxygen and carbon dioxide normally, so results in difficulty breathing. Next question, question number 21. Forceful expiratory techniques are option A, coughing, option B, huffing, option C, huffing and coughing, and option D, none of these. Here the clear answer is option C, huffing and coughing. Forceful expiratory techniques are used to mobilize and expel secretion. They include huffing and coughing. Huffing is forced expiration with open glottis. You should remember this. Huffing is forced expiration with open glottis. Next question, question number 22. Which of the following arterial blood gas values indicates a patient may be experiencing a condition of metabolic acidosis? Is metabolic acidosis. Option A, partial pressure of the oxygen is 91. Option B, bicarbonate is 190, 159. Option C, carbon dioxide pressure is 48 mmHg. And option D is pH value 7.33. Here the correct answer is option D, pH value 7.33. I have made a separate video for metabolic acidosis, or you can take a image of this. Next question, question number 23. The circumference of upper chest appears to be larger than that of lower chest in dash deformity. Option A, pectus excavatum, option B, pectus carinatum, option C, barrel chest, and option D, all of the above. Here the clear answer is option C, barrel chest. I have discussed this question many times. This is the image. So next question, question number 24. Percussion is contraindicated in untreated case of option A, aspiration pneumonia, option B, pneumothorax, option C, bronchitis, and option D, bronchiectasis. Here the clear answer is option B, pneumothorax. In pneumothorax, percussion can worsen lung collapse, so must be treated first with chest tube. Next question. Which of the following instructions would be most appropriate to give a patient who is learning pursed lip breathing? Option A. Exhale through pursed lip while contracting abdominal muscles. Option B. Exhale by blowing air out forcefully between pursed lip. Option C. Exhale by relaxing air out through pursed lip. And option D. Exhale in quick short puff through pursed lip. Here the clear answer is option C. Exhale by relaxing air out through pursed lips. Thank you for watching this video. Please do like and subscribe to my channel. And if you found the video is helpful to you, share with your friends. And please comment in the comment box if you want the second part of this video. Thank you.